Hello everyone and welcome. This is Michaela Conley, HP CareerNet. Here we are. It's Friday again. Joe, would you like to introduce today's presenters?
Why, I certainly would. Thank you, Michaela. Wolf Kirsten is founder and president of International Health Consulting based in Berlin, Germany. Mr. Kirsten consults organizations on the development, implementation, and evaluation of workplace health promotion programs, specializing on global strategies and culturally adapted programming for multinational companies. Barry is a principal in the clinical health consulting and global technology solutions practices of Buck Consultants, where he leads a global research and strategic development related to wellness and healthcare consumerism. In this role, Barry consults with employers to maximize the health and productivity of their workforce using innovative programs and technologies. Barry has 27 years of experience in the employee benefits field. He is a fellow of the Society of Actuaries and a recognized thought leader in health promotion and technology, with numerous awards and publications to his credit. Barry is a regular speaker at international conferences, is frequently quoted in news publications such as the Financial Times, Newsweek, and the Wall Street Journal, and has appeared on CNN, CNBC, and BBC television.
Thanks, Joe. Welcome, Barry and Wolf. Let's get started.
And thank all of you for attending on Friday. I think we've got a lot of interesting stuff to talk about, and we're hoping that this is going to be an interactive discussion as well. I'm trying to, okay, there we go. Hopefully you're seeing the overview slide now. What we'd like to cover today are talk about, first of all, what's happening. And we're going to talk about wellness, health promotion globally, much less focus on specifically on the U.S. than what's happening outside the U.S. and what that means to employers, whether you're based in the U.S. or elsewhere. What does it mean to globalize your wellness and your health promotion efforts? Because it becomes a different animal. So we're going to talk about some of what's happening around the world. What are some of the trends and the challenges? And I'm sure that many of you are from organizations that are well aware or a part of these trends and facing some of these challenges. We're going to talk about some of the key countries and what the profiles for workplace health promotion, what's going on in those countries, and then even what are some of the key global initiatives with organizations like the World Health Organization and the World Economic Forum. Wolf was a little bit more modest, I guess, in his bio. He didn't mention some of his most latest credentials. He's got a fantastic book out, and he's going to be sharing with you some of the information from that. And he's also involved with the World Health Organization and others in developing some of these policies that we're going to be sharing with you, some of what's going on. And then we've got so much to talk about, but we're going to try and be concise up front, so we'll leave enough time in the hour to have some Q&A, because there always seem to be a lot of interesting questions, and we want to be sure that we are helping all of you understand this in the way that's most helpful to you. So that's an overview. Wolf, you want to add anything at this point before I kick off on the first section?
No, that's fine, Barry. I guess that was my old bio. But I just want to welcome everybody, too. Thanks a lot for attending. So just go ahead, Barry. Thanks.
All right, thanks. And hopefully you're all following the slides along or have them on your screen. Some of the first data we're going to share with you is taken from a survey that Wolf and I have collaborated on with some other organizations. You can see there, Cigna, Pfizer, World at Work, as well as many other regional organizations around the world with members have helped to basically publicize this survey. It's a very ambitious undertaking. We're trying to reach as many employers in as many countries as possible to take the pulse of what's happening with respect to workplace health promotion programs. We've just released our 4th annual version of this survey. You can see the statistics there. We had 1,248 employers that participated, representing over 13 million employees in 47 different countries, all different sizes, all different industry categories. We have a global survey report that shares the information globally, which went to all the companies that participated in it. It is also available at bucksurveys.com. We have executive summary in 10 different languages and special reports on a variety of individual countries where we have sufficient data to report on some of the trends specifically in those countries. there's a lot of data. We're just going to skim the surface with a few highlights today to hopefully put some of this in context and help you start to understand what we're seeing in this regard. So let me launch into it. In terms of those 1,248 companies that I mentioned participated, these are where they have employees. You can see we've got a pretty good representation of workforces from around the world. And when we look then at, for those companies that said we have employees in that region, then we say, do you offer health promotion benefits to those employees in that region? And so it's a very simple question, and this is a, I wouldn't read too much into the results here other than to say it's clear that health promotion is a global phenomenon, that it's important to employers around the world and is being offered to employees around the world, being provided. Now, the form that it takes and the extent of, the strategy and a lot of other factors, how effective it is, can take very different forms in different parts of the world. But I think what's important to take away from this is that it is an issue. The health of the workforce is an issue that is important to employers everywhere in the world today. And even from what we've seen in the few years we've been doing this, it's of growing importance. It's a hot issue virtually everywhere in the world right now, which makes this a particularly pertinent and interesting and exciting discussion, I think. So here's a little bit of texture on that. If we look at how many years have employers had a wellness strategy in place, and I'm going to use wellness and health promotion interchangeably, recognizing that depending on where you are in the world and where you might be coming from, they do have some different connotations and different meaning, but in general, that's just kind of the catchphrase we use. I know wellness gets used a lot in the U.S. and tends to be one that I gravitate toward, whereas health promotion is probably a better one, talking in a global context. So that's just a little disclaimer there. But if you look at this chart, you'll see that 2/3 of the organizations in our survey are saying that their wellness strategy has been in place for less than 5 years. Now we know there are some, there are some great examples of organizations that have had successful wellness strategies for 10 or 20 or even longer years, and you can see some of them there. But don't know. I don't know. I don't know who answered don't know on this one, but you can see the majority of these programs are new, and so I think that helps explain some of the things that we're finding, some of the challenges and frustrations. Most of these programs haven't been around for too long. Now this is a particularly relevant and interesting statistic. Is your strategy global? And we're saying, now this is just for multinational employers. So employers that have employees in more than one country, we ask, does your strategy cover the majority of your employees regardless of where they are located? And just a little bit over half said yes. Now this is one that's been a big trend in recent years. It's moved up from, it was in the 40% last year, and in the 30s the year before that. So we're seeing a lot of motion toward this, and I think that's reflected in the interest, even the interest level in this webinar, as well as other things that Wolf and I have been doing collectively and individually in terms of speaking and webinars, et cetera. Michael mentioned there were over 200 folks signed up for this webinar, so I think it's a good indication that globalization is a key issue for employers to figure out how to globalize their wellness programs. Now, some of them are doing that. More of them are doing that. It's not an easy thing to do. Among those who said no, we ask a follow-up question: why? What are your reasons for not having a global strategy? And some of these, maybe perhaps all of these, will resonate with some of you. It's a different. Each country, each region is a different world to some extent in terms of health and how your health relates to your employer, and what laws and regulations and cultural issues and practices happen. So globalization is not a simple, monolithic approach if you want it to be effective and to work. Also, a lot of organizations don't have a global oversight for a healthcare strategy because of the nature of what they might be doing, or how they, even how they provide benefits or other services to their employees. There's just not a logical place in the global structure where this might be owned and lack of vendors and tools, not just, language and language translated tools, but culturally adapted tools, and vendors who can step up to the plate and say, we can help you, in these 17 countries where you operate, or these 3 countries. The vendor market in some ways is maturing a lot, but in terms of being, globally broad, that's a real challenge for the vendors as well as those who are looking for them. So that, in some cases, can be a hindrance. And pretty low on the list was this not a priority. So it doesn't sound like most employers are saying they don't care about this, they don't want to do about it, they don't want to do something about it, but more that it's something that they have some other challenges in getting it off the ground. So I would expect then that we'll see this number continue to rise as more employers figure out how to overcome some of these strategies or some of these barriers and at least get a global strategy in place. So this this chart shows you why employers are investing in health promotion around the world. What are the leading drivers? And it's not it's not a single reason, and it's not necessarily the same reason in different regions. Again, this is simplified, obviously. Taking Asia as one entity is clearly combining a lot of things as Europe and anything. We have split out the U.S. because the U.S. is kind of marching to its own drummer to some extent. You see them there on the right. So, for example, in this column, number 1, in any column, number 1 means that's the top reason identified by employers in that region as to why they are investing in a health promotion strategy. So number 1 in the U.S. column is healthcare costs. Not a big surprise to anybody that's working in the U.S. Also not a big surprise that in the rest of the world it's almost dead last. So that's an issue. What does the rest of the world care about? They care about productivity of their workforce. They care about having employees show up to work, not be lower absence, improve productivity, an increasing focus on morale and engagement. We saw that jump to number 2 on average globally this year. It had been at number 3 for as long as we've been measuring it before that. I think that's in part probably driven by the economy, or the recovering economy. Fingers crossed that it will continue, but employers are now worried about having lost engagement of their workforce over the last few years, and how do we help to retain that? I'm not saying that wellness programs are going to be the key to retaining workers, but I think it's a part of it, and I think that employers are increasingly recognizing that caring about employees' health and well-being in a variety of ways is a real positive way to continue to engage employees and hopefully retain them as well. And you'll see safety comes up here, workability, organizational values, a number of items. And some of these, even though they end up being lower on the list, doesn't mean that they're not important. I think this is a good illustration of why health promotion programs have such a broad global appeal, because there are a lot of reasons, a lot of different reasons, that it makes incredibly good business sense for any employer, no matter what you do. If you're a private company or a governmental agency or a non-profit organization, the health of your employees, having healthier, happier, more motivated workers is going to drive higher performance at whatever those people are doing, whether they're thinking or designing rockets or serving customers on the phone or whatever they're doing. The healthier they are and the more engaged they are in their own health and their coworkers and their organization, the better you are going to succeed as an organization. So there are a lot of reasons that pull toward that, and I think that's another reason that, although kind of wellness, the world of wellness and health promotion has had some ups and downs over the last 20 or more years in terms of being in and out of popularity, I think it's going to be here to stay, because there are so many reasons that it makes a lot of sense for organizations. So this is why employers are investing in health promotion. The next slide will show you what it is that they're investing in. What are the programs? What are the health issues, the health risks that are driving this strategy? So, and this one is again, I think, very interesting. You'll see stress being the #1 driver in the majority of the world, except for, primarily the U.S. is an outlier here with stress down at number 6. And let me clarify, this is not showing the prevalence of stress, for example, in these different regions. It's showing what employers identified as that they are addressing with their program. So what they're focusing on may or may not be related to the level of stress or the level of any of these health risks. It's what they are choosing to focus their programs on. So you'll see the top ones in the U.S. over on the right there are actually pretty high ranked elsewhere as well. And these are, from top to bottom on the chart, are the average ranking globally. So we see physical activity and exercise, healthy eating, we see chronic disease, we see things like high blood pressure. Obesity really kind of varies depending on the part of the world. But a lot of these things focus on, what we typically think of as health promotion programs. I think the stress really is an interesting one, and Wolf is certainly going to talk some about this and about how psychosocial issues and other factors come into play around the world in a lot of different cultures, and have really kind of come to a head in some areas of the world in recent years in terms of employers' awareness of the importance of helping employees manage stress. So I think there's a lot to be learned and derived from the information just on this page. I think it would be fascinating to do an entire webinar just on what's driving some of these issues here. But I'll leave it at that for now, and we can certainly talk about it, discuss it more if you have specific questions. I'd like to talk now about a really important metric or issue, and that is how is it organized within an organization? How is the ownership and control of the programs managed? Because you can see we have the results here for multinational organizations and single country organizations split out separately. And what you can see is that, and this is the degree of kind of centralization of ownership. You can see for single country organizations, they're moving more and more, and they have over the last few years moved more and more towards centralized ownership. Probably makes a lot of sense. With multinational organizations, they're not quite there to the same extent. And even talking to some of the leaders, another project that a research project that Wolf and I have been doing, which we're in the middle of right now, looking at good practices around the world. A lot of the companies would say, we started out with the strategy of globally centralized command and control, really kind of manage this from a centralized aspect. And we learned over time that that's really not the best model for health promotion, that the best model for us at least was this middle category here, centralized coordination with localized autonomy. We've got to get the people in the separate regions and countries and business units. We've got to get them on board. We've got to help them make their own business case. We've got to empower them ideally with tools and resources to do, to accomplish our global vision, but they are the ones that are going to really make it sing or not within their individual localities. So that seems to be perhaps an emerging best practice within the global world, and we can track over time how the survey responses follow with that. I've got a chart here showing incentive rewards, and I'll make the point. We could talk a lot about incentive rewards as well. My perception is that the primary focus on incentive rewards is coming out of the U.S. right now, and you can, to some extent, see that here. We've seen a lot of growth, however, in other parts of the world, even just over the last 4 years we've been doing this survey. You can see this shows what percentage of the survey respondents offer incentives today, and how many say they plan to offer them in the future. So big growth in most regions of the world coming up as well in this regard. And if we look more specifically at what type of activities the incentives are attached to, you can see, near the top are health screenings, workplace challenges, which have jumped up a lot in the last 2 years for a variety of reasons. Things like, The Biggest Loser, which is popular on television, and I don't know how many countries. But people are I think react well to some of the challenge type things, health screenings, preventive exams, and you can read on down the list. Again, look at the rate of growth, the second and third segments of each of these bars. Pretty tremendous growth rates predicted for incentive rewards. Again, this is global, so this is in all parts of the world. And again, it varies depending on when you cut the data different ways. I think the challenge here is that many of these incentive programs are new, and just because people are doing them doesn't mean that they're particularly effective. And Michaela has had some fantastic recent webinars. It was a great one with Alfie Kohn, talking about, are we totally, wrong to even be using incentives in the first place? Pretty engaging discussion and debate around some of those issues. And so I think, it really is important for us to consider, how effective are these incentives that we're using? Just because everybody's doing them doesn't mean that they're effective. So we have a question here that we ask. It's very simple. On a scale from 1 to 5, how effective are your incentive rewards at influencing the behavioral changes? And you can see how the participants responded here. I'm sorry, I have switched over to, this chart is for the U.S., although in fact this is almost, the numbers are only a few percentage points differently if we look at this globally as well. And if I can get my, there we go. Making the point here that on a scale from 1 to 5, if you consider 4 or 5 as being, in the effective range, only 1 out of 5 respondents said that their incentives are working effectively. So we've got a big challenge here in terms of incentive awards and how to use them to motivate employees to get engaged. And again, I think there's a lot we can learn looking outside the U.S. where incentive awards are not, especially financial incentive awards, are not as nearly as popular, yet there are plenty of organizations that have pretty good participation and engagement among their employees. Let me touch on a couple other things really quickly and turn it over to Wolf. Measurement is another key challenge. You can see here a very simple question. Have you measured specific outcomes in your health promotion program? Almost 2/3 of the respondents said no, we haven't measured. Essentially they're saying we haven't measured anything. And the reasons that they haven't measured are they don't have resources. Obviously that's a classic response. Don't know how to measure or don't have priority. I think what's encouraging here is the very small percentage of those who aren't measuring said that they're doing it because they don't believe there's a measurable return or they don't believe that the cost is justified. So again, if you think back to that early slide where it said, 2/3 of the programs are less than 5 years old, I think we're in a growing phase here. I think we're a lot of organizations probably that want to measure and that maybe realize they need to measure haven't done it yet. I think we need to get there more quickly as an industry to be able to find out what's actually working and how to do it. Last comment I want to make here is on a culture of health. This is another concept or a term that has kind of sprung out in the last few years. We see it initially within our survey a few years ago. We were hesitant to use it because we didn't want to impose it upon people. But in the we have a section where people can write in comments about their successes and their vision for the future, and we just saw this, some variation of culture of health, culture of wellness, culture of health and wellness being used over and over again by respondents from all around the world, which really kind of indicated to us that it is a concept that is really getting a foothold everywhere. And so we then started to pose some questions around it. And we have a very simple two-part question. On a scale from 1 to 5, to what extent do you currently have a culture of health, and to what extent do you plan to pursue it for the future? You can see there's a pretty big gap here right now. Only about 1/3 said they have a culture of health today, whereas 81% said they plan to pursue it for the future. So I think that's a concept that has definitely gained some traction and that employers are appreciating and linked into. I guess the other aspect of that is the recognition that it is a cultural issue. that improving the health of the population is not as mechanical as we might like to think it is. It's not just about incentives. It's not just about offering the programs, but it's it's driven by leadership of the organization, culture, environment, all those other factors, which maybe it's easy initially to kind of dismiss as not being important, but in fact those are probably the most important aspects of it. So those are the comments that I had prepared on the initial trends and survey results, and now I'd like to turn it over to Wolf to talk more specifically about what's happening in some of the specific regions of the world.
Thanks, Barry. Appreciate it. I just wanted to add on. I think this is the global survey is really exciting because it's growing every year, and especially we're getting more international tracking, meaning outside of the U.S., which of course is exciting, and just having more languages and more extra survey reports for countries where they get more than 50 survey responses. So that's good. It's good. I think it's a great process, and I'm not aware of any comparable survey like that. So, well, first of all, welcome from Berlin. I'm here in Berlin, Germany, on a Friday evening, and what I want to do in the next 15 minutes. It's a little bit daunting because I'm going to cover 7 countries. I'm actually not going to cover France, which you see here. It's not intended as a slide, but just to narrow it down a little bit. And even with these countries, I think it's already pretty daunting to try and cover. But I'd like to give you a flavor rather than just picking out one country and going a little more in depth. I'd like to give you a flavor of what's really going on issue-wise in these countries. And all of these are pretty much based on the Global Perspectives and Workplace Health Promotion book, which just came out. So going to the first country, Brazil. That's the next. Yeah, thanks. Basically, Brazil, as you know, is a huge country, very diverse, undergoing some really exciting economic growth recently. Health-wise, like many countries, challenges are plentiful. Basically, there is a national healthcare system and called the SUS, the services, and pretty much underfunded and lacking in quality, unfortunately. So a growing private healthcare sector has arisen over the last years and continues to grow. So that's obviously already something to be aware of and observe as an employer and as an employee also. The National Health Agency has implemented some regulations which are targeted to the private healthcare sector where they need to include health promotion. So there is some government initiative around health promotion and wellness, which is pretty exciting, I think. Overall, just to give you an overall kind of overview of programs, first of all, there are quite a few programs at the workplace in terms of health promotion. So you can find a lot of initiatives, some very good programs, very, very exciting. In terms of drivers or outcomes, most companies will tell you that it's to improve work climate or the ambience. Not so much in terms of direct costs or productivity, although that is growing, but it's still a little bit on the soft side in terms of the outcome measures. So there's little outcome data. I definitely wanted to mention the ABQV, the Association for Quality of Life. For those of you who have employees in Brazil or anybody basically with an interest in Brazil, I would definitely recommend to contact them. And Alberto Ogata, I don't know, he may even be on the call. He's the president and very accessible, so good resource in terms of workplace health promotion in Brazil. And wanted to also mention one thing, that a medical exam is mandatory by law to be provided by the employer. So that in itself, I think, is good, and it gives you an opportunity as a starting point to start a program. So some countries have that, like Japan's another one, but I think so that's an opportunity to start off. Moving on to China. China is the next slide, Barry. China is a huge country, obviously, the biggest country in the world. Major challenges, as you can see here. Still very much, as a lot of countries, if we look at it from a developed country perspective, as you know, there's a lot of countries with some key challenges in terms of basic occupational health services and hazards, and China is one of them. And just chemical poisoning, dusts, and so on. Still really a puzzle or a challenge for a lot of employers. actually the legislation is pretty good in China. Like since 2002, they have a pretty strong occupational health law. As in many countries, the key is enforcement. You know, that's not enough inspectors and so on. But I don't want to go into detail in terms of occupational health at this point. But you should be aware of that. That's still a major challenge in terms of China. There's some really fascinating data and projections on the aging process. You know, the kind of the one-child policy is kind of becoming a problem for China. And as you may have heard, they're actually revisiting that strategy. There's, as far as I know, there's no decision being made, but in terms of loosening or even changing that one-child policy just because of the really very fast aging trend that they have. And obviously that will have an impact on the workforce and will have an impact on health overall. So that's very important to know. Smoking amongst men is very high, 50–60%. So that obviously will have an impact, already has an impact in terms of disease and the productivity at the workplace. One other issue which may even be more prevalent and more challenging is stress, so work-related stress, pressure, psychosocial issues. However, it's very under, I guess, illuminated. There's not much research on it, not many reports. Stigma is very high. I mean, stigma in terms of mental health is high in many countries, but especially in China. So, you know, in its worst form, you see the results in terms of suicide, unfortunately, and you may have seen some of the news reports coming out of China on that one. So I think that's something in terms of having employees in China. That's definitely something to be aware of, and if you don't already know, I think you will come across that pretty soon in the future in terms of the employees. There definitely is an overall growth of programs. Not so many service providers and vendors out there yet, I think, especially if you're looking to quality. And then one aspect, I think, which runs through Chinese society is a strong separation of disciplines and issues. Again, you have that in other countries too, but I think it's very pronounced in China, and especially with a link to the occupational health inspection, which would make a lot of sense in terms of looking at some of the psychosocial issues too. Moving on, let's go to India. India, again, you know, economic superpower. But for those of you being to India, you will definitely have seen the roads, the infrastructure, which are not anywhere close to being an economic superpower. So really kind of puzzling. I mean, you have differences in many countries again, but I think India is kind of the pinnacle of that. If you think about it, 92% work in the informal sector. So how are you going to get to those people if you look at it from a macro perspective? How are you going to get to those people in terms of workplace health? You know, big challenge, you know, which World Health Organization is actually taking on at the moment. Vastly underfunded, unfortunately. Again, public expenditure, as you can see, very low. Medical insurance hardly exists. Still a very new phenomenon in India. So it's pretty much all about how much money you have and how much you can spend on your healthcare. So that obviously doesn't work very well. The workplace, as we all know, can provide a really good opportunity to address that, and some employers or leading employers, very often again the multinational ones, are looking at that, providing basic healthcare, primary healthcare services on the premises at the work site. So that's kind of I think a real opportunity, especially in terms of fighting chronic disease. In some industries, you should consider, and some of you may be in those industries, talent. You know, just like in the U.S. or in Europe, the fight for talent is very strong. You always talk about India with an endless pool of qualified workforce. It doesn't exist. I mean, obviously there's a lot of talented people, but in certain industries, even for call centers and business process outsourcing, talent is a huge issue. Finding those workers. So that in itself, as you know, health promotion can play a big role there. Very multicultural society, a big challenge in terms of languages and cultures, but I won't go into too much detail here. And also still very much traditional biomedical thinking, not so much integrated in terms of psychosocial. Let's move on to who we have next. The UK, I think, next country. Yeah. You probably are more familiar, a lot of you are probably more familiar with the UK. And there are some similarities to the U.S., but still also, you know, a lot of differences. The first big one is, you know, they have a huge national health services, the NHS. You know, major budget, as you can see, but really undergoing some tremendous restructuring at the moment. Basically, a lot is being cut. So that's a headache in itself for well, employers, but for people in general, just because the NHS won't be able to deliver the same kind of services in the future. Good news is that the government, from a different basically avenue, has shown some initiative in terms of the health, work, and well-being, and some of you may have heard Dame Carol Black speak about this, very eloquent speaker, and they are really doing some interesting stuff in terms of helping employers, providing resources, how to address, health, chronic disease at the workplace, including some interesting business case tools, which anybody can use and are free, so to say. In terms of the employees, there's still kind of a culture that it's free. Healthcare is free, and we can use it, and it should be good. But that, as I indicated, is not really going to stay that way. With the NHS, at least much lower level of that. And also, on the positive side, we do see employers becoming more and more aware of the role of health promotion and wellness in terms of productivity, and also reduce costs, especially if you have private healthcare involved. So there's more research on this too. So that's actually a good development. But overall, in terms of the health risks, pretty challenging. Going on to Finland. Finland is a small country, but it gets mentioned very often in terms of social issues, education, and also health. So that's one of the reasons I included it. The first line here is not that encouraging. As you may know, alcohol is a problem. It's actually the leading cause of death in working population, both female and male. It used to be only males, but now over the last, I'm not sure, like 5 years maybe, females also, and that's the leading cause. So that's kind of concerning, obviously, and very surprising for us. The systems, the healthcare systems, the occupational healthcare system, very sophisticated. Doing a very good job in terms of covering all their workplaces. But of course, they do face challenges in terms of chronic disease and as I mentioned, alcohol and stress and psychosocial issues. One of the main challenges from how they are approaching, how Finland as a country and the employers are approaching the issue of workplace health is workability. And that's interesting. Again, strong aging trend, documented very well in contrast to China. They are looking at workability, and they're really trying to, they have specific goals on how to increase the working years, productive working years. So they have a certain percentage they want to reach for workers in the older bracket, so to say. And the government is actually playing a really active role in that. And that, I think, is an exciting initiative in itself. And looking at a broader, concept of health. They're looking at well-being. They're looking how to adapt like work methods, content, job content, the working environment to basically fit the older worker. And at the same time, of course, working on the individual life skills and healthy lifestyles of the workers too. So, and again, this will lead to a sick leave reduction, in sick leave and pension costs. So, I think Finland is in terms, at least in terms of government initiative, is really well on the way to addressing this. Going way south, South Africa, totally different, but again, some similarities. So, first of all, you all know HIV/AIDS, a huge challenge, in sub-Saharan Africa, and especially in South Africa. But as we saw from the survey, what Barry showed earlier, it's for those employers, at least who participated in the survey, it's not the #1 challenge anymore. That doesn't mean it's gone, but HIV/AIDS, some of the leading employers have really done a lot over the last 10 years. There's some very impressive programs and some impressive gains actually being made in terms of keeping people, if they are HIV positive, keeping them at work and keeping them productive. So I can give you plenty of examples of some mostly larger companies who have been very successful doing that. So the chronic disease is now kind of cropped up, and it seems like that they're not as well suited to address that. That they haven't really found the solution, if there is one, to addressing chronic disease. So that's really a characteristic now of South Africa. Again, you will see this common theme here of universal health care. It's underfunded and lack of quality, and also in South Africa. So again, a little bit of the onus has been shifted to the employers and employees with that. And so again, larger enterprises are kind of taking the lead here and are developing some more broader, full-fledged programs coming from HIV/AIDS, focusing on HIV/AIDS, now looking at chronic disease. And actually, interesting enough, also I just heard that today that the Global Business Coalition on HIV/AIDS, TB, and malaria, which you may know, is also now looking at a broader approach. This is basically very new, and they're going to discuss it in the next meeting. So I think that's also a sign of the times that it's not so much disease-focused anymore, but taking a broader approach to global health. So I think that's very interesting. Next slide here, the UAE, small country. I wanted to bring it up because it's a very interesting case study in itself, and the countries around it in the Arabian Gulf are very similar. And obviously, you know, with the oil, it's a strategic importance for the world, but you know, also interesting for many other reasons. So basically, the chronic disease, the global chronic disease picture that we know and have is even more pronounced in that region. So I wrote here 20% plus of diabetes. The plus could be as high as 5% because the statistics are not that solid on that one, but we all know that the diabetes rate is very high in the UAE, one of the highest in the world. And of course, with that comes you know, obesity and lack of activity and the metabolic syndrome and all these things. So key challenge. Road traffic safety is also very concerning, especially amongst your younger males. So that's something to consider, especially as an employer with your you know, driving safety programs. Good news is that the healthcare infrastructure has really improved over the last 5 to 10 years. A lot of new clinics. As you know, there's some money in the region. So that is good, but on the other hand, very little on prevention. You know, invest very little on health promotion and more proactive approaches. Hopefully that will come soon, but so far it's hard to find. Challenging, extremely diverse workforce, people from all over the world. You know, like the UAE basically has, I think it's 80% of the entire population is expats or foreign. So that in itself, you know, provides a huge challenge of developing any kind of program. And then, you know, with the lack of focus on prevention, there's a lack of qualified professionals, unfortunately. But interesting, a relatively new thing, the government in Abu Dhabi, which is one of the Emirates of the United Arab Emirates, and they still have quite a bit of autonomy, they are or have developed EHS, so environmental health and safety management standards, and one of the 19 areas is wellness, which is, you know, very good. I think I don't know of any other government which basically mandates it in terms of the employers having to. This is very new, so we have to see how it is enforced, how it comes along. But at least it's in there, and employers are going to have to, you know, in some way or the other, are going to have to address this. They can't just ignore health promotion or wellness with their programs. Moving on to the next slide, I know I should finish up in that. The next, I wanted to show you a couple of global things because I think these are really important as we move forward. There's a lot going on, and I wanted to quickly show you. I talked about this last year a bit more in detail, but the healthy workplace is being pushed by the World Health Organization, and I think it provides a very comprehensive and logical model. Basically, you can see these 4 areas where it's, you know, beyond personal health resources. It looks at, well, physical work environment, which is, you know, more conventional occupational health that we're familiar with. Psychosocial work environment, you know, how is the work environment having an impact on your stress and on your psychosocial and mental health? And then the enterprise community involvement, which pretty much equates with CSR, corporate social responsibility. And in the middle, we have a continual improvement process that you're probably all familiar with. But I just wanted to show that to you because I think you will see more of this coming through from various organizations, but driven by the World Health Organization. So that's a pretty exciting process going on. Just a couple of other initiatives. The next one is from the World Economic Forum, the Workplace Wellness Alliance. I think it's interesting. It's mostly for large companies, and they have a consortium. But there's also some resources which are available for free, like the Wellness app, which is kind of like looks at your like an ROI calculator more or less, where you can calculate in terms of your health risk, what programs you implement. You know, it's an estimate, obviously, but you know what kind of financial impact you can have. So I think that's from a resource and tool perspective very interesting. And then the third one was is the IAWHP. This next slide is the International Association for Worksite Health Promotion, which you may be familiar with, focusing on practitioners. And I think it's the only really membership organization that I'm aware of which is global in this field. So and we're growing. I'm working with that organization and trying to grow the international membership base as we go along. So that's kind of an exciting process. So last slide is to conclude. Basically, pretty much applies to all the slides, also that Barry presented. Good news, we heard there's global growth in workplace self-promotion, and I think we'll continue to see that. As we saw from the survey, productivity seems to be the main universal driver, and throughout the world, so that's good. Chronic disease and mental well-being and stress, huge challenge. That's a huge area in itself, but as you saw, stress was the #1 in many of the regions. Kind of a glaring need for more of that evaluation and measurement, as you saw the numbers from the survey, unfortunately. And then it seems to be that we also need a more integrated framework, and that's why I showed you the WHO framework. I think that could be or is an integrated model which could serve us well, because unfortunately still a lot of programs are very fragmented and work in their kind of own discipline. So I still see a need for that, and hopefully we'll make some progress. So I'll leave it at that. I know I went a little quick, but I hope you got some useful information out of it. And in any case, you can follow up with me or Barry or both of us. And let's open up for questions for the rest of the time.
Super, thanks. A lot of great information. Okay, couple of questions here, and if you have questions, feel free to type them in or raise your hand if you are a brave soul and want to speak directly to Barry and Wolf. Krishna, hi Krishna. She wonders, she said, can we assume that the companies who have answered the survey are by nature more interested in wellness? And if yes, then how prevalent is wellness overall, say in Europe, in terms of percentage of companies doing wellness compared to the total number of companies?
Yeah, this is Barry. That's a really good question, and I think in general the answer is yes. This is an open survey as opposed to a random outbound calling, like a poll. So there is some element of what we call selection bias. That is, companies or organizations that choose to take the survey, you could expect that there would be a higher percentage of them that are interested in this topic and have chosen to do it. So that's why I don't think there is a measure of, what you're asking for in different geographies, what percentage of employers are, active in workplace health promotion. Now there are, within the U.S. there are a lot of surveys out there, and frankly the numbers that we see from just our U.S. population cut are often very, very much in alignment with what we see from other surveys of U.S. employers. I'm not aware that there are any other surveys outside the U.S., so we're kind of the sole source of data, and I don't want to imply that the percentages we showed you at the beginning are representative, but I think there's a broader question on that, and that is how would we even define, if it's a yes or a no, if we're giving a single percentage point, that means you're either doing it or you're not doing it, and what is it that you're doing? And I think that gets back to that question about, how effective are the programs? Are they really being measured? Is just offering a, Weight Watchers class at lunch, does that qualify you as having a workplace health promotion program or not? And I think what we need to get to as an industry, and what Wolf and I and the others that collaborate on this research are focusing on, is how do we put some more parameters around defining what it is to get a feel for a broader level of texture as to where are different organizations around the world. Because I think if we split it up, and there was a study, it's about 5 or 6 years old now, that an early one that did that and said, some large percentage, I don't have the number off the top of my head, 90% of employers said they had a health promotion program, but when we defined it based on these 5 key principles, it went down to about 7% of them actually had a program as we would define it. So I think there's more to be done in that regard. Any comments on that, Wolf, in terms of your perspective as you're out and about in different parts of the world and what the prevalence is or how to measure it?
No, I basically would echo that. I think there's very few countries which actually have some data on that. Like I know Singapore has some data, the national survey. I think the UK has a little bit, and the US obviously, but it's very hard to see. So I think sometimes in your job, I think you basically think that all these companies are doing health promotion, but then if you take a step away, you see that the majority probably are not. If we define it like you said. So.
Mm-hmm.
So I guess you could say that we're really on the edge of the wave, which is a good and bad, challenging place to be.
Yeah.
Okay, let's see. Don Ardell wants to know the trends report prepared by SRI International. SRI is at the behest of the Global Spa Summit, entitled Spa and the Global Wellness Market, was produced to encourage leaders throughout the larger destination spa industry to embrace wellness and health promotion. And his question to you is, have you seen evidence of this occurring?
Well, thanks, Don, for the question, first of all. I'm not sure if I understand, Michaela. Have you seen evidence of what specifically? Of a growing trend, or what was it?
Yeah, have you this SRI report on encouraging spas to sort of take up the wellness flag, I guess. So Don's wondering if any of your research findings have identified that spas are taking up, or I guess spas are doing this.
Yeah, and from my point of view, not so much. But maybe I'm not just tuned into the spa world. But I know there's some movement going on in Germany and in some other European countries, and I haven't seen any good outcomes data with regard to that yet. But that's a good point. So maybe we should look into that some more.
Well, it's good to know that we're not the worksite's not the only one talking about it. Let's see, Jessica. Let's see. Can the data or information related to worksite health on college university, can the data or information related to worksite health on college and university campuses, can you apply this to faculty and staff members who work in higher education?
What specifically, like the data that Barry presented, or?
I'm a little confused on that too as well, Jessica. If you can clarify, that would be great. I think what she's saying is work sites. Do work sites include colleges, universities, or are these primarily multinational corporations?
Yeah, well, I can answer. I mean, that resonates with me a little bit. I'll agree. I'm not sure I completely get the question, but absolutely we have some higher ed organizations, number one in our study, but I also have some clients that I'm working with directly, and one of them is coming to mind where there's a tremendous opportunity. The environment, I mean, there are a lot of different environments out there, workplace environments, but a university is one that's particularly intriguing because there's the student body, there's the faculty and staff, and the university's goals are typically to, a lot of things. They're about learning, they're about creating an environment that is conducive to that. It's about having a healthy staff. It's about having healthy students that are engaged in, not in the process of learning, but also in their own health, and, all these things go together. And it's its own kind of self-contained environment as well. And they have, even, physical education programs. They may have curriculum around nutrition or sports or nursing or, maybe a variety of different things, academic endeavors and research that they're doing that ties into aspects of nutrition, physical activity, medicine. So it's, and so I think some of the, and I think we'll continue to see this, universities that really, and it comes down like a corporation, it comes down to the leadership. So you get a university president or board or someone who gets it and says, we have an incredible, environment here to really promote better health, and it's going to make us more profitable, more successful, more effective at educating our students, all the types of things that we're starting to do. So I think it's a tremendous opportunity there, and I hope we're going to start to see some exciting things coming out of that as well. There was one item in the news which reminds me now, I haven't seen much on it since it originally came out, but it was reporting on one university that said they were putting a BMI, not quite a requirement, but it was sort of presented that way in the news, that you can't graduate if you're obese, basically saying our duty to our students is not only to educate them, but to sort of, turn them into, I want to say well-rounded individuals. I'm not trying to make a pun there, but basically that, we have a responsibility to all aspects of their health and education. So it'd be interesting to see if anyone else goes down that path. Did you have something to add, Wolf?
I know we're running out of time, but just quickly, I know that there, in terms of the settings approach to health promotion, that the universities looked at as a setting additional to the workplace, and there are some programs along the lines of health promoting universities. I know of a few in Europe, and they're following specific criteria in terms of what a university can do in terms of being a health promoting environment. So, if you're interested, you can contact me on that one.
Maybe if you're familiar and such, maybe you'd like to come and talk about that, because I know that there's a lot of conversation ongoing about creating that healthy environment at the university setting.
Okay, could be a good one. Yeah.
Yeah, I think that'd be great. Let's see. We have a whole bunch of questions, and we're really not going to have time to get all through these. I'll throw you a nice ringer, though. All these questions will be, I'll get them, or Kelly will get them to you so you can follow up individually. But here's I think, an easy one, and I bet I could answer it. Annie wants to know, what's the best way for an up-and-coming worksite wellness professional to get involved in international work? Wolf, go.
Well, first, continue to listen to ID Wellness webinars, right?
That's right. Good answer.
And, well, I told you about the IAWHP. I think that's, it's still a young association, but it's the only one that I know of with a global mission, and it's practitioner-oriented. And I know there's a number of students and young graduates part of that. So I'd recommend you to do that. And as we grow the membership international, you'll see that you will have more opportunity to. We already have international members. It's not like that, but to interact with professionals from all over the world. So again, I can give you information on that if you want.
Yeah, I think I would completely agree that you have to start somewhere. You need to get yourself into a place where those conversations are happening, and beyond the IAWHP right now, it's a little difficult if you want to talk specifically about worksite health promotion. So I think that's a really good resource. So, and I think the conference is coming up next month?
Next week, actually.
Oh, next week. Yeah, wow. Next week. Where does the time go?
I know it's.
Yeah. So check into the conference too if you're in the Anaheim area. Show up.
Exactly.
Okay, we are out of time. Thank you so much, Barry and Wolf. Wolf, I think you should get me a updated bio so that I don't shortchange you anymore, because you're certainly no slacker. You're plenty busy, I suspect, and maybe some days even more than you'd like to be.
I will do. Thanks a lot. Yes.
Good.
That was my fault.
No worries. The slides and this recording will be available shortly on Health Promotion Live, so you'll be able to grab them. Actually, the slides are already there, but re-watch the recording, share it with colleagues and such. Barry, thank you so much. Wolf, thank you. It was great. I appreciate you being here. And I'll see you guys next week.
Yep. Thanks, Michael, and thanks, everyone, for attending.
Thanks so much.
Thank you.
A lot of fun. Thanks a lot.
Bye-bye.
Bye-bye.
Bye.